Hi, I'm John Vickers from Golf Swing Body Mechanics International, located in sunny Miami Beach, Florida. So today I'm going to talk to you about low back pain during golf. If you're experiencing low back pain while you're playing golf or after your outing, then this is the video for you. In the first video, I talked about the two primary causes of low back pain, and those are poor joint mobility and poor body mechanics. In this video, I'm going to show you the #1 move that's going to create back pain for you. And it is based both on, actually, and most players, it's going to be based on poor mobility at two or even possibly 3 joints that I showed you previously, and poor body mechanics that are created by that limitation, and in addition to instruction. So here's that move, because that's the most important thing you should see, because you can find out for yourself if you're doing this. So I'm going to go to the skeleton. When I go to the top of my backswing, so I'm just going to move the skeleton, hip bones and pelvis. So when he goes to the top of his backswing and he's rotated and starts his downswing, and when he starts his downswing, his body, his pelvis moves towards the target and tries to rotate. That's the move that's going to hurt you. And why that's going to hurt you is this. Is because when you start your downswing, your left leg should be able to remain posted, and your hip or pelvis rotate around that. And as you can see, when that happens, this left hip rotates back the way you're instructed to do. Now, when you get to the top of your backswing and you start your motion by making your hips move laterally that way towards the target, that direction, then this hip bone, you can just see your hip bone didn't do this, your hip bone did that motion. And so this combination of trying to rotate your hip as it's moving lateral doesn't work very well, because the other thing that happens is that as your femur gets closer to your hip bone, there's less space for it to rotate because of the tissue, that being the muscles and the skin that are there. There's less space for this to move. And so that's going to create tightness. And that's going to create stress and strain on this side, and it's going to create strain on this side. But as you're going to impact with your body, as I turn the skeleton around, you're going to want to rotate and side bend. You're going to have to side bend more, which means your upper body is going to move this way more or lower towards the ball. And that is going to put a lot of stress on this side of your back and on this side of your spine. And these vertebrae in the lumbar region aren't designed for rotation like the muscle or like the joints in your thoracic region. In the upper part, they rotate easy. In this part, they're not designed, and so you're going to get stress in this area. And that is what's going to create your low back pain. And again, if you're going to start your downswing and your first motion is to make your hips move this way, one, there's no way you can really post solidly on this leg, and your hip rotate back. But if it's posted well, easy to rotate back. If it's not, it's hard to rotate. Another way you'll be able to notice on video is that if you see that when you start your downswing and your hip only rotates a little bit and it continues to move this way as your upper body turns, that's going to create a back pull, or strain in your low back, or back pain, or even hip pain or tightness on this side. So that whole move, that whole scenario creates the issue that I'm talking about. So in the next video, I'm going to show you ways to prevent that.